Hey, everybody. The Natalies are back. We are here. And oh my gosh, there is so much going on. For any of you that haven't been with Natalie Squared here before, I'm Natalie Bensavenga, host of Facts Over Fear, here with my wonderful friend and colleague, Dr. Natalie Gentile. She is a healthcare disruptor. I'll let her tell you all about what that means, but she's also a primary care physician and a direct primary care physician. And there's a distinction there, which we will talk about. Founder of Rebel Wellness and co-founder of Direct Care Physicians of Pittsburgh. Dr. G, how are you today?
It's always good to be with you, my fellow disruptor.
Yes. Speaking of disruptions, okay, you guys, we have quite a few topics we're going to run down today in the realm of public health chaos. First, we're going to be talking about the CDC fired a bunch of people, like 1,600 people, and they've rehired back a bunch of them. And they basically sent out a memo saying, oopsies, sorry, didn't mean to do that. So we're going to hit on that. We're going to talk about the fact that there's been yet another measles outbreak, this time in South Carolina. What does that mean for us as the United States? Could we now have issues traveling internationally? That's a problem. An open enrollment season is upon us. Things are going to get really weird this year because of the government shutdown, because Medicaid is on the chopping block. Even if you don't have Medicaid, this is very much going to impact you and your insurance premiums. Dr. Gentile is going to discuss that. And then we're going to wrap things up with a quick update around COVID vaccines. Pretty much anybody can get one now, but I don't think a lot of people know that. So we're going to talk about why is there so much confusion. Seems like a good place to start. So, Dr. Gentile, I'm pulling this from The Guardian, and I just want to read you a little excerpt to get your thoughts. The firings of hundreds of employees at the Centers for Disease Control, CDC, have been reversed, according to several reports citing officials familiar with the matter and the American Federation of Government Employees, which is the largest union representing federal workers. Now, on Friday, the White House Budget Office announced that as a result of the ongoing government shutdown, reductions in force, RIFs, across agencies had begun. The CDC initially said that employees that received layoff notices were designated non-essentials by their respective divisions. However, over the weekend, because this made my head spin, because at first I thought we were going to be talking about the firings, but here we are. The administration rescinded more than half of the 1,300 termination notices it sent out to public officials, according to Axios and Reuters. So around 600 people at the agency still remained fired. Now, the New York Times reported that members of the Epidemic Intelligence Services, informally known as disease detectives, were among those reinstated. Wow. So what were your initial thoughts as someone that has been trying to make sense of all of what's going on with the CDC right now from a physician's perspective?
I'd say every day I'm confused. So let's start there.
Right.
I'm not the
Well, if you're confused, then we're in trouble.
So definitely confusion. You mentioned it in an email we exchanged this morning, whiplash, right? So you're just trying to keep up with it. The main concern I have as a physician, on the front lines of medicine and primary care is if there's not continuity of people who are running the CDC, which is where we get a lot of our information on day-to-day practice of medicine, frankly, then how much is there on continuity of updating that information that we receive, right? Like if we don't have consistent people there, if we have reductions in force, then what does that mean for the how really up to date everything is that we are practicing then? Especially when it comes to infectious diseases, which is a regularly changing field.
Yes. And also, I'm sure you're experiencing this, and I'm sure your colleagues are as well, but are your patients coming to you confused about what's going on? Are you confused about what to tell people? Because I always looked at the CDC growing up as just one of those things, a fixture sort of in our public health landscape that you could kind of depend on. Maybe there were some variant opinions within a decision, but for the most part, like 95% of the time, I felt like I could really trust what was going on there, even with all of the things that we hear around, the conversations around big pharma and big healthcare. There was still something about the fact that it's like the CDC is made up of a bunch of doctors and scientists and researchers and healthcare administrators that are living outside of the political space, And now as somebody like yourself who takes care of people regardless of obviously their political affiliation or their status in terms of economics or anything else, have you found this to be very challenging trying to even get your patients to understand that you are trying to be nonpartisan in your care? How does that even work anymore?
It's hard to walk that professional line, I'd say, when you're having discussions with patients, because in the end, this is public health. I've
Yeah,
heard people say, healthcare and medicine is, political, and I understand where they're coming from, right?
sure.
Because a lot of these decisions are, as we're seeing, something that is on the chopping block in politics, depending on who's the president, right, and who's in power. So I'd say, though, on a day to day basis, my practice of medicine is not political.
Right.
And therefore, I am frustrated when that is impeded by political changes,
Yeah.
right? And geez, I think more than all of that, though, minus the politics, it's when people who have no idea about the practice of medicine, no
Mm.
history of practicing medicine, no idea of what it's actually like, are going in there and making these huge sweeping changes, and its downstream effects are very detrimental to our practice of medicine.
I wanted to read you a quote on the firings at the CDC, why this is even happening at the first place. A federal health official told ABC News that they had mistakenly fired all of these people due to a coding error. Neither the White House nor HHS have responded, but Greg Gonsalves, who's an epidemiologist and a member of the Defend Public Health, which is a volunteer network, he said these firings are an assault on the health and lives of every person in the United States. Did they not care enough to find out who they were firing and what they did before sending these termination letters? The carelessness and the callousness with which this administration handles life and death matters is unbelievable. What is your response to that?
So we call this in medicine a symptom of a bigger issue, right? And I think that behavior like this, which is not new, I'm not surprised by any of this, right? Like, so
Mm-hmm.
this is not like this is new. We've now been experiencing this since January.
Mm-hmm.
These haphazard moves, these kind of gut instinct moves that are not planned, are a symptom of a bigger issue, which
Yeah.
is exactly that, a lack of trust, understanding of public health.
Mm-hmm.
And sowing that distrust by these types of actions is very dangerous in a public that in a population that's already not super trustful of healthcare, right?
Yeah.
And of public health. I mean, some of the things that I see people commenting on social media, like, you did this during COVID, what do you expect? Saying that to those of us in medicine, like,
Mm.
as if we are the reason why people felt slighted during the pandemic. It's very interesting to me. They're
Yeah.
just feeding into this distrust by these types of chess moves that are completely, clearly unplanned, and not really fully thought through.
Well, it's sort of like, are they evil geniuses or just complete morons? And I'm
What are we
leaning
missing here?
towards, yeah, I'm leaning towards the morons part. And like he adds at the end, excuse me, another person says at the end of this article, the CDC damage is done, rescinded firings or not, U.S. health security is compromised. And I think that's my biggest concern about all of this, beyond the whiplash effect, beyond the we're firing people, whoopsie, we didn't mean to, we're going to hire most of them back. We're still almost like working with like a broken leg right now. It's like you're trying to run a marathon and you're dragging this leg behind you because of the chaos, the mass firings for no apparent reason. Like they said, there hasn't been a reason given for this. You can blame the government shutdown if you want, but like to your point, this has been happening way beyond just the last few weeks. I want to lead into the next topic here because I think it really speaks to what you were just saying about sort of placing blame and the disinformation machine in overdrive, and it's having real life consequences. This article from CBS News says 153 unvaccinated students were quarantined after a measles exposure in South Carolina. This just happened yesterday, Monday, October 13th. In a media briefing, officials confirmed that these students were exposed contacts without immunity, leaving them to be excluded from school until the period of potential disease transmission has ended. This is the state's 11th case of measles this year, and its 8th case just since September 25th. What this case tells us is that there is an active, unrecognized community transmission of measles occurring in the upstate, which makes it vital to ensure that the public have received their measles vaccinations. This is from a release from the South Carolina Department of Public Health. Do you sometimes feel like you woke up in like an alternate universe when you're reading this, that we're talking about measles? Measles, Dr. G.
Absolutely. Absolutely. This is dystopian at this point. It's very, it's like, is this a bad book? And I want the book to be over.
You're like, I just want to finish reading this.
I just want it to be done. Yeah, I do find it incredibly concerning. And I think what has happened here is, if you watch some of the like hearings where, for example, RFK Jr. is being absolutely grilled, on things that he's said, and he denies that he's said them, even though it's written that he's said them, and some of the things that are said during these hearings are like, you've straight up said before, fill in the blank, and a lot of it is around anti-vax sentiment. And it's not hard to find that he's said these things. And if that is now brought into the ether, right? Like these questions are brought into the ether. His response is typically, I'm just asking these questions because someone needs to. We have a broken healthcare system. We are the sickest country in the world. And it's interesting because on its face, he's not wrong. Right. We are a sick country. We do have a broken healthcare system. So he's not wrong. So then it appeals to that within a person who says, well, okay, that actually makes sense.
Yeah.
And so then, therefore, whatever he says after that must also make sense. And what is happening is he's coupling something that actually makes sense with complete misinformation that now has permeated into our country with a lot of people, again, who are already ripe for the picking. And who's more ripe for the picking than parents of children who just want their kids to be okay and safe and healthy, right? Like most parents, we can all disagree on a lot of things, but most parents want their kids to be safe and healthy. And if someone is saying, guess what? Vaccinating them against measles, they're probably going to become autistic. Guess what? Giving them Tylenol, like just the list goes on and on. Circumcising your kid now, apparently. Parents are going to question this and they're going to be nervous about it. So now where do we unravel this? Because now, the train has left the station, I think.
Yeah, I couldn't agree more. And you made such a good point, because with every great grift, with every great con, there's always that kernel of truth at a part of it, because that is how you hook most people. Because you're right, the healthcare system is broken. Did RFK break it? No, it's been broken. Is he willing to point out that it's broken? Yes. But is he now really expediting? Is he like smashing what pieces are left? Absolutely. Two things can be true, right? And so to your point, I think that's such a completely honest assessment of where we're at. And the reality being, you have a bunch of parents who are completely overworked, who have fewer and fewer social supports, who are trying to make ends meet. And now they're being told if they do X, Y, and Z, they could harm their child. My God, is that a recipe ripe for disaster? And what scares me about this, Dr. Gentile, to your point, is that I don't know how we put the genie back in the bottle. Like, part of the reason I wanted to do these regular chats with you around public health and health in general, wellness in general, is because I wanted to talk to somebody that I know I trust, to give proper information out and just try to make a slight ripple in the other direction. But it's going to take so many of us doing this kind of work to make an impact against these huge machines that are now over and over being bought by the billionaire class, who really has different desired outcomes than I think we the people do. So to your point, I don't know what the answer is, but I do know that if we continue to see measles outbreaks, if we continue to see outbreaks of other diseases, we are possibly going to lose like our status of having not really ended these diseases. And therefore, it could really start to impact our travel, our ability to travel internationally. I think what frustrates me about all of this is there is this idea that, well, it didn't happen to me, it's not happening to my kid. But these things, they ripple out and they do impact you, even if you technically don't even have a child, right? So, and that leads me to a big old ripple effect that is happening, that we're seeing right now. And that really comes down to what is going on with open enrollment season this year. And for people that don't understand what open enrollment may be, can you explain to them what we're about to dig into and why this year it could look very different than other years past?
So tis the season of open enrollment, and people are, those of you who choose your own health insurance plans, small business owners, people who are independent contractors, et cetera, are looking at this like, what am I going to do for my health insurance in the upcoming year? And the concern here is that the premiums are going to significantly increase this year. And I think there's multiple factors that are weighing into that. One cited is that, medications such as GLP-1s, the weight loss medications, are incredibly expensive. That has risen, as far as their uptake. And so the cost of insurance can be higher because of the cost of these meds. That's one of the many reasons. Another one being that I think a lot of people don't realize is when we've got Medicaid on the chopping block, and we've got also people who, seeing the premiums rise as a potential, might opt out of insurance completely. Most of the people who are going to be opting out of insurance are going to be your younger, healthier people. As we have that population of younger, healthier people out of the insurance pool, because whether you like it or not, you are paying into a pool for
That's what insurance is.
Okay, that's what insurance is. You're paying into a pool of population health here. So if we take the healthy out of there and we leave an ever-aging population who is on multiple chronic disease medications, history of hospitalizations, risk for rehospitalization, et cetera, those premiums are going even higher because those premiums are based on the population health that they are insuring. And so when we have this taking place, I think a lot of people we're going to see opt out of getting insurance in the first place, or a lot of people potentially bankrupted by healthcare costs.
This is what keeps me up at night. Like, I've been fighting for this issue since I was 17 years old, and I quickly realized like what a broken system we had, and that was many years ago. But to your point, not only has it not gotten better, it's gotten a lot worse. And the books that I read and the things that I read have truly predicted this, which is really fascinating to see from a totally dispassionate perspective, just how when you don't stop a runaway train, how fast it collides into a wall. And I think that's what we're really witnessing right now is this collision. And what scares me beyond the idea of people not being insured is, to your point, the people that are left, God forbid, they need surgeries, they need support, or a younger person, because of our terrible air quality and water quality and all of these things, more of them are becoming susceptible to weird cancers and cancers that you normally didn't see under 50 years of age. And so let's say they opt out and then they end up in the ER and they're diagnosed with something. Now they don't have health insurance, where Medicaid might have become the thing that they had in the past. Yeah, that's no longer happening. Okay, so that's the first thing that freaks me out. The second thing that freaks me out is, Dr. G, when we're looking at, okay, all these people are getting kicked off of Medicaid goes away. A lot of people in rural counties, their hospitals, their doctors rely a lot on those Medicaid patients to keep the doors open. So even if you and I don't have Medicaid, but let's say we utilize that hospital in Beaver County or Butler County, that hospital's now gone because they had so much relying on that. So now all of the people of that community have nowhere to go. What if you're pregnant and there's now a maternity desert because that was the only hospital that had a maternity ward? So you can really see, once again, when we're talking about these ripples, how scary this gets very quickly. But what I love about you and what you do is you try to be very proactive and try to be very community focused. So can you share a little bit about an event you have coming up? Because I do think that this is very important and worth letting people know.
A lot of my patients have these questions. And so out of that, I said, we probably should just have an event so we can kind of answer them and people can lean on each other. I think we learn a lot from each other in community. So on Monday, the 27th of October from 6 to 8 p.m. at my studio, Rebel Wellness, we as direct care physicians of Pittsburgh are going to have a town hall type style setting around open enrollment. We want to hear your questions, but we also want to hear what's been working or not working for other people in the community. And we also will have an insurance broker there to answer some questions about insurance and insurance options and help to help people understand a little bit about like this alphabet soup of all of the insurance types and options that there are out there. And we'll also talk about direct primary care, which can be a really great option for our uninsured patients, as well as our underinsured or our patients wanting a high deductible plan, but really wanting full spectrum family medicine or primary care along with that. So I think it's important for people to know that there are options out there. And as somebody who is proactive, as somebody who really tries to stay positive despite all of these things burning around us, one thing I've been talking to my patients lately about is your consistency is resistance in itself, right? You're sticking to the things that you know are best for your health, the community support and social support and community action, that is resistance.
Yeah.
And seek solace in that and understanding that that can be an important part of this movement to get our public health back in order. And it's not going to be immediate, but I think it will happen eventually if enough of us really speak out about this and talk about it very honestly.
Amen to that. As we wrap things up here, I just wanted to give a small update around the COVID vaccines because you and I have had many conversations on this platform about what has been going on and the changing landscape with the vaccines. But what we're hearing now is that you can get one if you want one. And people, I think, aren't aware of that on a macro level at this point. Can you talk about who now is eligible for a COVID vaccine? And are there any hoops that they have to jump through at this point in the game?
So I think why people think they can't get one right now is because, again, the whiplash that we experienced in September was that you can't get one without a prescription. Only certain people who qualify can get it. There was all these questions. Now the party line is you can get one with shared decision making with your clinician. And my problem with that is we have an incredibly overburdened healthcare system already where you can't get in with a doctor for 6 months for a non-acute issue. So that clinician conversation, okay, RFK Jr., are you going to be the one having it?
Right.
I mean,
right. And I also don't think people understand that can also be the pharmacist.
Yes.
And I don't think that's clear.
But the pharmacists are overwhelmed too.
Yes.
I mean, if we look at all of it, nobody's sitting around twiddling their thumbs. And I think that's where the beauty of direct primary care is, but, where we have that time with patients in continuity, but we ain't on every corner, right?
No.
We aren't serving the entirety of our population. And so the reality is you don't need the shared decision making. If you want to go get the COVID vaccine, you should be able to go to your pharmacy and get it for all intents and purposes right now. Now, that could change tomorrow. We're not sure. But just understanding that, I think that this was yet another smokescreen out there, this shared decision making that leads people to just a little bit, enough of a barrier for you to second guess if you should go get it or not.
Which is wild. I just want to bring this point to the forefront for everybody. President Trump did go get his COVID shot and his flu shot just the other day. So if you're worried about, what do the people at the top think about this stuff? They're going and getting vaccinated too. So what is funny about that is for all the things that you just shared, at the end of the day, clearly this is good enough for the president, so it should be good enough for all of us. Dr. Natalie Gentile, thank you so much, as always, for sharing your insights and your incredible analysis of the news of the weird at this point, as we're calling this segment. It used to be called What's on Your Plate, but now I'm just like, I don't know, things are weird, you guys. Someday we're going to get back to talking about wellness and health, but there's so many things on fire every time I reach out to have a conversation with you. So thank you for always grounding us in reality and sharing evidence-backed information. If people want to learn more about you and your work, where can they go?
They can go to @Natalie Gentile MD on Substack, YouTube, and Instagram.
Wonderful. All right. Thanks, everybody, for showing up and sharing your thoughts and your comments below. Dr. G and I are going to try to continue to do this every other week to share as much health information as possible. So please make sure that you share these videos with your communities as well. And until next time, everyone, please take care of yourselves and each other. Have a great rest of your day.